numbers from the CDC show that childhood obesity is on the rise. It is now at the highest rate ever recorded, and experts say this is a distressing milestone.
Dr. Alaina Vidmar is the medical director of Obesity Medicine and Bariatric Surgery at Children's Hospital Los Angeles. Thank you so much for being here.
Absolutely. Thanks for having me.
You know, we see these numbers and we report on these numbers all the time about how they're going up. The rates of obesity grew slightly, just from 20 to 21%, it looks like last year, but it was around 5% in 1971. So I think that's what becomes jarring to people. Why are we at this point now?
Yeah, it's a great question. So I think it's multifactorial. I think that we know that these rates have increased, but what's most important, I think, to understand is that pediatric obesity is a complex chronic disease. And it is not the fault of the young person or their parents, but we know that it is environment, it is genetics, and it is biology. And so I think that we know that our food environment has changed, and this is changing genes over time.
Oh, it's changing genes.
So it's changing how young people can use the food that they eat, how their metabolism is working, and how their brain is actually controlling when they're hungry and when they're full.
Interesting.
And I'm sure this makes it even more complicated for parents who understand that there's not just one thing they can change to fix it. They also probably don't want to make their kid feel bad because of, you know, how we talk about size and image in this culture. So how do you address this without making a child feel bad?
Yeah, it's such a great question. I think the most important thing to understand is that, again, this is not the young person's fault or their parents. It's how they're made. So I think the work that we do is really understanding that it's not about the number on the scale or the size of one's body, but that we want these young people to live long, healthy lives. And we want to try to prevent life-limiting complications like type 2 diabetes, high blood pressure, high cholesterol. So we're really trying to treat the underlying condition and use the toolkits that we have to help these kids live long, healthy lives.
So talk about the health of it versus the actual body part of it.
Exactly, and really break the weight stigma.
That makes sense. I hear some parents, as kids enter kind of that adolescent stage where they get a little bit of puppy fat, they'll grow out of it. But early intervention really is key.
Absolutely. And I think acknowledging that it's a complex chronic disease and not someone's fault really helps us to understand that there's no evidence to support that you can outgrow this. So we need to intervene early. We need to think about comprehensive care. So we need to combine lifestyle modifications. Sometimes we need to use medications. We need to help kids to live healthy lives.
Well, I'm glad you just brought that up because obviously we see in adults the rise of GLP-1. I think the statistic was like 1 in 8 adults have now tried a GLP-1. Are we using it in kids? And how young are we using it in kids?
Yeah, so it's a great question. So we know that the American Academy of Pediatrics recommends that we think about using obesity pharmacotherapy in kids as young as 8, actually. And we know that we have FDA indications in kids starting at age 12. So we really are using these medications in our toolkit whenever they're appropriate.
Interesting. So what has been most successful with your patients? What are you using most commonly for kids who come in?
So I think what's important to know is every tool has its own efficacy. So I think we know that the GLP-1 injections are the most effective for the most young people. But again, I think you have to match the tool with what the young person needs. So if you need to lose 5 to 10 pounds, that might be lifestyle alone. If you need to lose 30 pounds, that might be an injection. And if you need to lose 100 pounds, that might be weight loss surgery. So you've got to match the tool to the kid in front of you.
So if there's a family out here right now and they're looking at their kid going, I'm struggling here, I haven't come in, should they come into the doctor, make an appointment? What is the first course of action?
So I think what's really important to understand is what are the resources you have. So at Children's Hospital Los Angeles, we have a comprehensive care program. So we want pediatricians and families to know you should think in your area, how can we come to a comprehensive program and get the treatment that we need to really think about how can we help our kid live the best life that they can.
Absolutely. Should parents be concerned if they do go the GLP-1 route that young, that then the child will need that for the rest of their life to stabilize their weight?
So I think we're really still trying to understand what is the answer to that question. But here's what we know. I think the earlier you intervene, the more likely you're going to achieve those goals and decrease risk. And I think the better chance you have of not needing it lifelong.
Interesting.
And that's why early intervention is so important.
Oh, well, I'm so glad you were here today to clear some of this stuff
Dr.
up.
Vidmar, thank you for being with us. An important conversation.
Absolutely.
Thank you so much for having me.